Hello everyone, good evening. Here we meet again in yet another episode of BMC Global Live AL-HILAL Health World, nothing but lifestyle. I am Jessila Mujib. Cholesterol is a type of fat that helps our body to perform many important functions. But too much of cholesterol in your blood may increase your risk of heart attack and stroke. To discuss about this subject in detail, we have with us Dr. Eldho George from AL-HILAL Hospital, Salmabad. He is a specialist in internal medicine with an experience of over 12 years. So, doctor, welcome to the show.
Hi, good evening. Thank you for inviting me to the show.
So, doctor, that's a pleasure. So, doctor, please explain about cholesterol in general for us.
Okay, cholesterol, as you rightly mentioned, it's a wax-like substance that is present in the blood. And in general, we have, when we check the cholesterol, we check total cholesterol, like that is called lipid profile, like total cholesterol, triglyceride, LDL, HDL, VLDL. Okay, and HDL is considered to be a good cholesterol, whereas LDL and others are considered to be bad cholesterol in excess amounts. Okay, cholesterol is mainly needed for our body functions because it synthesizes so many vitamins. It is essential for the production of so many steroid hormones in the body, even bile acids that is required for the digestion of fat, and even vitamin D, the production of vitamin D. So, in a way, cholesterol in good amounts, it's required for the normal functioning of the body. But in excess amount, it's dangerous to the body.
So, doctor, what are the factors that affect our cholesterol levels? I've heard that heredity and also our lifestyle play a role in increased levels of cholesterol. How
Yes,
true is it?
It is true. Like heredity, familial hypercholesterolemia is genetically transmitted. This is what you have mentioned. And lifestyle, like sedentary lifestyle, lack of exercise, excess amount of fat, like saturated and trans fats in the food, then smoking, alcohol. All these plays an important. These are the major lifestyle factors that are affecting the increase in cholesterol levels.
So, doctor, we know cholesterol, increased levels of cholesterol has no major symptoms. Then how can we know a person has cholesterol?
Okay, that is mainly when we check blood levels for cholesterol. We usually come to know when it is in the almost in the border levels and all. But as such, there can be vague symptoms like muscle aches and all. If you are having high levels of triglycerides and all, you can go in for pancreatitis symptoms and all. Then there can be xanthelasma, xanthoma and all. All of these are suggestive of an increase in the cholesterol levels. Okay.
So, what are the tests you would suggest for cholesterol?
Mainly the test done is called fasting lipid profile. That you should have an 8 to 12 hours fast. Then you should go for your blood checks in the for cholesterol in the next day. Like night you should take a minimum diet which less cholesterol foods and all. Then after an 8 hours to 12 hours of fast in the early morning and in an empty stomach, then you can go for your fasting lipid profile check. Then in that there are we check 5 types of cholesterol levels, like total cholesterol we check, then triglycerides we check, LDL, HDL and VLDL we will check. Okay, and certain ratios also we will check. Okay, so the ideal limits, that also you should be knowing. So total cholesterol, ideally it should be less than 200 milligram per deciliter, and triglyceride should be in the range of less than 150. HDL, which is considered to be a good cholesterol, it should be ideally above 40. Above 60 is considered to be a safer limit. Then LDL should be less than 130. Ideally it should be around the level of 130. Okay.
So, once we find out that person has high cholesterol, would you suggest to start medication immediately?
Depends. we will consider what all comorbidities he is having. Then, or his cholesterol levels are not controlled with diet alone. Then we can consider directly moving on to the treatment. So, if a patient has a total cholesterol of less than 200 or ideally 240, 200 to 240, then he is having cholesterol, but he can try for dietary modification or lifestyle modifications. But still, if it goes above 240 and all, then we ideally consider taking medicines. And also, as I said, is considering his risk. There are certain people who are having family history of certain heart diseases, like myocardial infarction, or a patient having stroke, or a patient itself had a myocardial infarction or a stroke history. Then he is at risk so to prevent this risk, we have to start cholesterol this drugs.
Can you make it more clear about the treatment options?
Yeah, we have mainly there are multiple drugs. Most common drugs we prefer is statins. So there are most of you might have heard atorvastatin, rosuvastatin, simvastatin. All these statin drugs are used for reducing the cholesterol levels and increasing the HDL levels, other than the diet. Okay. Then there are other drugs called omega-3 fatty acids. Then some patients will be having increase in triglyceride levels, like hypertriglyceridemia. For them, we use drugs called gemfibrozil, fenofibrate, and all. Then drugs like niacin, then bile acid sequestrants. All these drugs are used. But commonly used drugs are statins because it has got a cardioprotective effect.
Okay, doctor. Another common query is once we start the medication for cholesterol, can we stop it or is it lifelong?
Like some patients, as I previously said, will be having comorbidities like diabetic, hypertension, and risk for cardiovascular, is having risk for cardiovascular diseases or a stroke. So in that cases, it should be ideally lifelong. Or if he has suffered a heart attack previously, then in such cases it should be lifelong. Most of the patients will be, even though they don't have cholesterol also, considering its cardioprotective effect, ask them to continue these statins for lifelong. But if a person is having a borderline cholesterol level, not controlled so much with diet and all, and after taking tablets and he is sure that he can be able to control it with diet, we can give a try, if provided his dietary control is good and no other risk factors are there.
So we have to test in between and check.
We have to test in between and check.
Okay. Doctor, any other side effects for this statin medicines?
80 to 90% statins are safe. Okay, and other drugs have minimal side effects, but considering the risk benefit ratio, it's better to continue the drugs, and it doesn't have major side effects. Some have, like statins, some statins can cause an increase in liver enzymes, but not very significant rise. But that doesn't, if it goes to a very high level only, it needs to be stopped. But no, most of the times 90% of the people doesn't have these such side effects, and some patient can have muscle aches and all. But that also in a very fewer amounts, fewer people, very minimal people all are having. So in that case, you can ideally stop the medicine and see. Okay. And that is the only thing. Some drugs can't be used in like in hepatic dysfunction, like liver dysfunction. Some cannot be used for some can cause GI disturbance, gastrointestinal disturbances, like bile acid sequestrants and all can cause some GI disturbances. Then ideally all these are minimal side effects only. So there is no harm in continuing the drugs.
Okay. So doctor, we would like to know about the complications of cholesterol. You have already mentioned about some, but make it more clear for
Yeah,
us.
like ideally an excess amount of cholesterol gets deposited in so many of the body tissues and as well as in the major blood vessels and all. So this is a risk factor for development of cardiovascular diseases as well as stroke. Like LDL is LDL triglyceride, and all these can cause if it in excess amount deposited in the blood vessel, it can hinder or cause blockage of the blood flow and thereby causing more cardiovascular risk like myocardial infarction, heart attack, or it can go in for stroke.
Okay, heart attack and stroke are the
Major complications. And in if triglycerides are increased in the blood, like say some are having above 500,000 and it can very well cause pancreatitis diseases of it can cause inflammation of the pancreatitis. It can go in for acute pancreatitis, which is a very dangerous situation.
Okay. Now, can you suggest some lifestyle modifications to normalize cholesterol?
Okay, one of the main lifestyle modification I suggest is reduce the amount of fried items. Saturated fats like beef, pork, such things should be reduced in amount. Okay, don't eat so much of fried items. Okay, then many have misconceptions about coconut oil and all. Reduce the amount of coconut oil. Okay, then egg 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 as such, the yellow part is considered to be high in cholesterol levels, but as consider egg as a whole, it contains so many vitamins, minerals, and even a good amount of cholesterol. But you have to reduce the intake of the red. You should not avoid completely because it has got so many other effects. Then cashew nuts, I'm telling about some misconceptions that people are having. Cashew nuts, ideally it can be taken, but not roasted or salted. Plain it can be taken, but not in excess amount. Okay, all these it can be taken. Then other lifestyle modifications like stop smoking, avoid alcohol, then this increase intake of green leafy vegetables. Then oats can be used. Oats in a diet can be used. Excess carbohydrate should be avoided, like rice items and all should be reduced. Sugar items should be reduced. All these fried items like french fries and all should be reduced in amount or should be avoided. Then like apple can be added, like fruits like apple. Then fish can be added, which is good source of omega-3 fatty acids. Even some certain sea fish contains good amount of omega-3 fatty acids, so you can use that one. Then you can use olive oil for garnishing of salads and all. Then beans, then almonds, all these can be added because these contains X amount of fibers, so which can inhibit or decrease the absorption of cholesterol. Like eggplant, oak is and then lady's finger. All these lady's finger has also a misconception.
Yes, because of the slimy consistency.
But it can be ideally included in the diet also.
Now, what about the exercise, doctor? What type of exercise would you prefer to control cholesterol?
Like reduce your, like at least walking exercises, that can be ideally, it's good. Then you have to reduce other exercises to reduce your fat, excess fat, that to abdominal fat and all, it should be reduced.
So, doctor, now what's your advice for our viewers regarding the subject?
Once you have diagnosed with increased cholesterol levels or increased lipid profile, don't worry. Like you should not be worrying too much. You should be careful. You can try with dietary modifications if you are in the border levels, or if you are having high cholesterol levels, you can go consult a doctor and you can take medicines. And don't have the misconceptions that all the medicines are having side effects. As I said, statins have least side effects. You can start statins because it can be a it can offer you a cardioprotective effect also. And as well as your lifestyle modifications. So if you are having a sedentary lifestyle, or if you are having lack of exercises, if you are having so much of saturated and trans fat, kindly you please try to reduce that one. So ideally you can reduce, or you can control your cholesterol by all these methods. Like you can take drugs, along with that dietary modifications. And one thing about misconception about cholesterol in excess amount only, it's dangerous. When you accidentally or found out that your lipid profile is on the higher limits or in the moderate levels, don't worry too much, because cholesterol in excess you should be careful, because it can have complications. There are different methods that you can reduce your cholesterol. Ideally dietary modifications, lifestyle modifications. Then once you have diagnosed to have increased cholesterol even after the dietary modifications, then you can consider consider medicines for your treatment. Like you can consult your doctor very well, and depending upon your increased risk factors, your cholesterol level, he will suggest you medicines. And don't worry in taking medicines, because most of the medicines have minimal side effects only. Don't worry about side effects. 90% all these medicines are safe, and most commonly used drugs are statins only, and they are considered to be safe also.
So thank you, doctor. Thank you for joining us today and giving us a lot of valuable information about cholesterol. Thank you once again. So viewers, if you find out you have high cholesterol, don't panic. As doctor rightly said, with right lifestyle modifications, you can manage your cholesterol levels. Stay happy and healthy. This is Jessila Mujib signing off. Good night.